Let me recognize the gentleman from California, Mr. Cox.
Thank you, Chairman Neal, Ranking Member Brady, and members of the Ways and Means Committee. Thank you for the opportunity to testify before you today. My home district, California's 21st, faces many unique talent challenges. No district in America produces more milk nor more meth than the 21st. In 2011, a Measure America study that assessed community well-being, according to income, healthcare access, and education, ranked our region as the poorest in the nation. According to the American Lung Association's 2019 State of the Air report, my district has the worst air quality in the nation. Naturally, this results in a huge number of residents with asthma and chronic obstructive pulmonary disease, COPD. COPD is the third leading cause of death in the United States and is the fourth most costly condition with respect to hospital readmissions. In addition to managing complex chronic conditions, my district has many rural communities that face unique healthcare access challenges. Access to care in these communities can quite literally be a matter of life or death. We've recently lost 3 hospitals. Some of my constituents drive over an hour to receive basic care. In the event of an emergency, like a heart attack, an hour drive is a drive straight to the morgue. In many areas, healthcare is delivered through local community health clinics and federally qualified health centers. I applaud the services these clinics provide, but together we can and must do more to meet patients where they are and deliver the care in a way that meets their unique medical needs. Doing better includes being innovative and bringing the resources, such as telehealth, to rural areas. Telehealth helps connect patients to the right care at the right place at the right time. For constituents in my district, an hour-plus drive just isn't feasible. They need telemedicine options for long-distance clinical health services and ongoing management of chronic conditions. This is why I was proud to introduce the Better Respiration through expanded access to telehealth. The BREATHE Act, with my colleagues, Representatives Mike Thompson of California, Mike Kelly of Pennsylvania, and Buddy Carter of Georgia. This bipartisan bill will establish a pilot program to help Medicare beneficiaries with COPD and asthma receive telehealth services such as disease management, patient education, and self-management assistance from qualified respiratory therapists. Constituents in my district, like John Dominguez, a Vietnam Bronze Star recipient with COPD, will greatly benefit from this program. John lives an hour away from the nearest VA, but through the BREATHE Act, he'll be able to receive care and treatment for his COPD and related issues when he can't travel. Mr. Dominguez is not alone. There are 4.1 million Californians suffering from pulmonary disease who could benefit from this program. Over a 3-year pilot period, the program will provide timely access to care for Medicare beneficiaries to remain in the comfort of their own home while reducing the financial burden to Medicare. This bill also allows Congress and the Centers for Medicare and Medicaid Services, CMS, to evaluate the value of respiratory therapists as telehealth practitioners and reducing utilization and costs while improving outcomes for patients with COPD. I urge my colleagues to support this bill and all telehealth bills that expand critical access to care. I'd also like to bring attention to one more unique challenge to the committee's attention that impacts the Central Valley, valley fever. Some of you may know or have heard about valley fever. For those who haven't, valley fever is an infectious fungal disease that lives in the dirt in areas throughout the southwest United States. Valley fever is contracted by inhaling the spores of an airborne fungus when the dirt is disturbed by wind, farming, or construction. Once inhaled, it can cause an illness that might seem like a cold or the flu. The infection spreads from the lungs throughout the bloodstream, affecting other body systems, and can be fatal without appropriate treatment. Currently, there's no vaccination nor cure for valley fever. And today, unfortunately, only 1 in 4 infections are actually diagnosed. Recent data from the Kern County Health Department shows that nearly 3,000 people were infected last year. I applaud the commitment and dedication that the Kern Medical Center and the Valley Fever Institute at Kern Medical has given to fighting this disease, as it is the only place in the world that offers valley fever treatments. As a member of the Valley Fever Task Force, led by co-chair Representatives Kevin McCarthy and David Schweikert, I am committed to working on the meaningful solutions that will strengthen research and advance treatment and vaccine development for valley fever, as well as other orphan endemic fungal diseases. I look forward to working with all of you on these important issues that I've shared today. And with that, I will yield back the balance of my time. Thank you so much.
Thank the gentleman.